Hello, everyone. Welcome. So good to have you here. We're excited. This is going to be a fantastic day. We're just going to give everybody a few moments to get in here. We actually have quite a large RSVP for this. So we'll just give everyone a few moments. I'm Dr. Pamela Crisco. I am the board chair of the Psychedelic Association of Canada right now. And while we're letting you all come in, reminding you, if you're coming in as a guest, please mute yourself. Thank you very much. Maybe put in the chat where you're coming in from, what your profession is, if you're a social worker or if you're coming in as an interested other party, that's great too. And a little bit about the Psychedelic Association of Canada. It's pretty much a 99.9% volunteer run organization. And so super thrilled to be pairing here with Laura and Kipper that, brought this really forward at SFU. And we love amplifying good work. And this is certainly great work. Thanks, Kipper, for putting your info there in the chat. And so what we'll do is we'll jump right in. I've got all the panelists pinned here today. We've got a fantastic group of folks that are joining us, taking some time out of their Friday. So if you wouldn't mind, I'll introduce, everyone can introduce yourself with a short introduction. And we'll start with Laura, and then we'll go to Anne-Marie, and then to Keith. And then we'll keep going after that to everyone.
Perfect. Thank you so much, Dr. Pamela. My name is Laura, and I am a registered clinical counselor and registered social worker, and I've been in the field for about 10 years plus. My work has mainly focused on supporting individuals and families and really meeting clients where they're at with their mental health challenges and just working around that. In addition to that clinical work, I have been involved in the last 2 years with SFU. We're doing research initiatives under Dr. Kiefer Carr, who's present today. Just really understanding emerging approaches in mental health care, policy, and really understanding the space of psychedelics and policies. So that brought us here to this space, and I'm grateful, and I'm hoping that we can have really good conversations today. Thank you.
Thanks, Pam and Laura. I'm Anne-Marie. I am a registered social worker and registered clinical counselor practicing here in Victoria, BC. I've been an RSW since 2015, and I've been working in mental health care for 15 years. 7 years I've worked in various low barrier harm reduction roles in Vancouver's downtown east side, and I've been working in psychedelics since 2017. I was executive assistant and volunteer coordinator with the Multidisciplinary Association for Psychedelic Studies, MAPS Canada, and that was primarily promoting research, fundraising for the MDMA for PTSD trials that were phase 3 at the time. I also did a practicum and worked for TheraSil, where I supported their patient intake team with helping Canadians with end-of-life distress apply for psilocybin-assisted therapy through the Section 56 exemption to the CDSA program that Paul will speak to more later. And so I had an opportunity there to screen patients with end-of-life distress for psilocybin, liaise with Health Canada and their healthcare practitioners, and also provide some of that psilocybin-assisted co-therapy for those early exemption holders. I now work in private practice as a therapist and consultant, and I have specialized training in psilocybin, MDMA, and ketamine-assisted therapy. Thank you.
My name is Keith. I'm chairing for Victoria, BC. I'm here to share my lived experience and the struggles that got me into seeking out psychedelic-assisted therapy and the struggles that possibly could be out there for people moving forward with these new guidelines.
All right. Thank Karina, Mary, Cody, and Paul.
Hi, everyone. It's so great to be here with you all. My name is Karina, and I'm a registered social worker in the provinces of Ontario and BC, and I'm located in Squamish. And yeah, and I've been a social worker for about 8 years, I want to say. I have worked in many different settings, more currently in the nonprofit sector, as well as in private practice. And I have specialized training, as many people here in the group, in working with psilocybin, ketamine, and MDMA through TheraSil, MAPS, the Multidisciplinary Association for Psychedelic Studies, and with Catalyst Mental Health as well. And yeah, I'm very passionate about this work, and I'm hopeful that we can hopefully have a good regulatory structure to provide this work more safely and openly to people. And I'll tag Cody.
Okay, thanks, Karina. Cody Callan, joining from North Vancouver, British Columbia, and really honored to be here. I'm a master's trained social worker, RSW. Historically, I've worked in the field of substance use disorders and harm reduction as a service provider and researcher. I've worked in hospital settings and also treatment settings as well. And in the last, I guess, 8 or 9 years, really have leaned into training as a trauma therapist and working in this specialty area of psychedelic-assisted therapy. I worked on the end of the phase 3 trial here with MDMA to treat PTSD in Vancouver. And I've also worked with Health Canada Special Access Program exemptions with MDMA and psilocybin, as well as with ketamine-assisted therapy, all in sort of interdisciplinary team settings. At present, I do that at the Center for Medicine-Assisted Therapy in Vancouver. Thanks for having me. I think Mary was next.
Hi, I'm Mary Casamano, licensed master social worker in Baltimore, Maryland. So I'm in the United States. And I started my work with psychedelics in 2000 at Johns Hopkins, which is in Baltimore, Maryland, when we started our first psilocybin study, when it was coming back on board after being dormant for so many years. And I was a guide at Hopkins until 2024, so 2 years ago this August. And I left and have started my own business, Psychedelic Support and Integration. And so I've guided hundreds of sessions, mostly with psilocybin. Some we use dextromethorphan and DXM and salvia. Did a number of studies with salvia. And then I trained with Prati, and I am on the staff there. I work in their training when they do end of life with CAP, ketamine-assisted therapy, and took the MAPS training, but never was involved in their studies. And then CIS, which is the California Institute of Integral Studies, their psychedelic certificate program. I've been a teacher and mentor there since 2017 when they first began. So, and I'm still there. So, thank you. I'm honored to be here with everyone. And Paul, I think you're next.
Oh, well, thank you, Mary. Paul Lewin. I'm a lawyer in Toronto. I've been a lawyer for 32 years. I am a criminal lawyer, a regulatory lawyer, and I have a bit of a focus on the Constitution. And my practice is very focused on drugs and all aspects of drugs. And I'm super pumped to be here.
What a crew, what a great group of people. And just so you know why I'm here, I'm a physician and I'm board chair of the Psychedelic Association of Canada. I'm the medical lead at Roots to Thrive, which is a nonprofit that works legally with ketamine, psilocybin, and MDMA. And then also the medical chair of the postgraduate certificate in psychedelic-assisted therapy at Vancouver Island University. So we're going to jump in. So what a great group. Everybody here has got great skills, and this is going to be a fantastic conversation. And so we really need to lay the table here so that everyone knows where we are, where we were, where we are, where we got to. So then we'll bring in Laura, and Karina and Cody and Anne-Marie will all jump in and fill in this robust conversation about where were we and where are we now and what does that mean? Laura, do you want to start us off?
Sure, absolutely. I'll provide a little bit of context and then I will leave it to my social work fellows to just help me build this story and where we're at. So, um, recently we know that the College of Social Workers introduced a new practice related to psychedelic-assisted therapy. And really what stood out specifically for me, what is that this guideline was released without meaningful consultation with professionals, with people that were in it, right? And so that was a bit challenging. Um, there was never a clear guidance. There was never clear structures in place for us to do this work. So everyone was trying to find ways that work for them. One of the things that was very clear is that we could have conversations about self-harm reduction. We could have conversations about psychedelics, and maybe that's how safe you felt at that moment. But now things have shifted, and so we don't really know where we're at. We understand that the college wants to implement guidelines for safety. And what we want to do is open a conversation with the college and have a conversation about clear guidelines and dialogue and how those things come to be. Under Dr. Kiefer at SFU, we have been organizing for about the last 12 months. We have a community of practice. We come together. We have designed some guidelines. We know what it takes. And so we want the college to be able to tell us their process and how they've been doing some of this work around these guidelines. There is a disconnect between guidelines and the realities of clinical practice. And what we know really is that we want to meet clients where they are. We want to meet families where they are at. And so these guidelines are making things a little bit more difficult to do that. I don't know if any of you, Anna Marie, Karina, or Cody, you have anything kind of just else to say, but it's taking us from a place where we were trying to figure out ways to do it. And now it's just feeling a little bit more difficult, if not impossible, to do this work. And it can be from a conversation about self-harm to actually what it looks like in practice.
I'll chime in, Laura. Thank you. I'd actually reached out to the college directly a few years ago to ask for practice guidance because I had an opportunity to work on a research study. The contract for that required my insurance to cover me as an individual practitioner. My insurance is provided in association with the Canadian Association of Social Workers. I imagine many people that might tune into this have such insurance and covers us if our scope of practice or if we're practicing within our scope of practice. So I wanted to reach out to the college and ask if what I would be doing, working as a therapist on a study with medicine-assisted therapy, under the purview of a doctor and not handling the medications, but, working alongside this practice would be within my scope of practice. And I was told that they weren't in the, business of providing practice guidance in these sorts of instances, that they are predominantly kind of a complaints-based organization and they'll investigate claims. So it was kind of surprising to me a few years later, that this guideline comes out. But as you say, I think a lot of us have been left for some time here as the research has been emerging in this area, as people are expressing more and more interest, as there are dispensaries, at least in Vancouver. I don't know about other communities in BC that are selling mushrooms containing psilocybin and in many cases other psychedelic medicines. And so people are interested in this stuff and asking questions and, having a history and a career in harm reduction, some awareness of harm reduction psychotherapy practice. I've been of the understanding that it would be, my ethical and practical responsibility to educate people if they have questions about this. And, and that's where there's, I don't know if we want to get too much into I won't get into the details of reading the policy right now or the guidance, but I think there's some confusion or ambiguity here now about what we're able to do in terms of harm reduction practice, and particularly, needing to avoid any kind of advice giving that might be seen as, encouraging people or, letting people know how to enhance or optimize the effect of what they're doing when, in this area of psychedelic assisted therapy and harm reduction, often what we're trying to do is reduce harms and increase the chances of positive outcomes for folks. And that's where their questions are often coming from. So it's a little ambiguous and confusing, that piece, to me at this time.
Yeah, I can jump in and just add another layer of confusion. Laura and I and many other registered social workers in BC are dual registered as registered clinical counselors. And the BC Association of Clinical Counselors came out with some psychedelic guidance in October 2024. And my understanding from the community was that it was really well received. It's really positive, really supportive. It's still, really clearly laid out the legal pathways through Health Canada, but the language was really supportive. It was, really encouraging of harm reduction supports and conversations. It also had a big focus on training and supervision, and there was a really large, thorough reference list at the end that showed they really did their due diligence of looking into evidence-based science and what's out there. And it just seems that in comparison, I'm registered, I'm an RCC, and then I'm an RSW, and that guidance that came out just in December, I believe, was just so restrictive, so prohibitive, really legalistic. And honestly, it feels really fear-based. It feels more like they're scared of, scared of us doing this work. And I totally understand the need to have these conversations, have regulations, prevent harm, because absolutely harm has been and will continue to be caused in psychedelic settings. But this actually, I believe the guidance creates more harm, puts the public at risk in certain ways, especially around not being able to provide that safer use information. So to me, it's been a really confusing experience to hold both of those credentials and navigate this. And it's why we're here today. So thank you.
And I think to add to that, what it's important to also, I guess, acknowledge is that not all professions that provide clinical care are regulated in the same way. Clinical counselors have an association that is based on volunteer membership, and so they are not regulated by the government in the way that we social workers are. And as Cody mentioned, for the longest time, I have reached out to the College of Ontario, to the College of BC, looking for guidance. And they kind of just said that if you're working within your scope, then you're good. We don't have any opinion. And so, so coming up with the guidance without consulting with anyone, kind of like ignoring the science, feels a little bit abrupt. But when we think about, the College of Alberta, for example, they have a regulatory structure set up, and they recognize that social workers can provide this service to people, and that psychedelic-assisted psychotherapy is within the scope of a social worker if they have training and supervision and they work on their prescriber and all of the things that matter. But it's really more about the fact that the regulatory structure is lagging significantly. And because of that, we're kind of like putting this place where we can do the work that we know could be happening and could be helpful to people. And then we're kind of forced to act as an extension of the law and to ignore the science, which makes it all really uncomfortable and just sad for clients who are desperate to find something else, another option, right? And not to mention that the commercial space is like even moving faster than the science at times, with advertising, marketing, and commercializing all these different drugs that they're hoping to patent and whatnot, and in the unregulated space, people are doing this work already, offering it to people, and how can someone really navigate the space without knowing what would be like the minimum standard to work with somebody in this way, especially people who are vulnerable and who have suffered a lot. And so it's just a very confusing space for people to navigate. But yeah, I'll leave it at that.
Thank you all. And to give context, with our college at the College of Physicians and Surgeons, whenever there's going to be something like that, generally what comes out to the membership is, this is a draft. Here's a draft guideline, and you have X number of months to comment on it and get in there. But what I'm hearing from all of you is that this did not happen. This was kind of just tossed at you, and now you're in this space where many people have possibly been working in some sort of way to support people, and now you don't know what to do with that. Am I getting that right? Okay. And
yeah, I think this just landed in our inboxes one day for all the registrants with the BC College of Social Workers. It was, I think, for me at least, completely, unexpected.
And let me even clarify bigger. Like, is this something like in your college or any the social work colleges? Is that normal? Like, have in the past, have you just been given a guideline, or you've always been said, have a draft guideline come your way first and then get to comment? Or I'm just wondering if this is out of character for the college to do this.
I've been registered with the college, I think, since 2011, and I can barely remember times when I've received an email with a practice guideline from them, and don't recall any time when consultation had been requested. But I think it's actually even rare for them to publish a practice guideline, let alone. And I think that their process is, at least to us here, like not very clear or transparent about how that came to be.
Mm-hmm. So we'll get more to the impacts, but what we're going to do is we're going to bring in Paul here for some time, or a few moments here, to answer some questions, to really give the legal look at this and the framework for that. So you've read the guidelines, Paul. So how would then, if somebody with a social worker designation is attending at an unregulated psychedelic session in some sort of support, how is that? Is that a criminal offense, and how do you see the college would be looking at this?
So yeah, it is a criminal offense. So the guidelines aside, you actually are committing a crime. It's a very modest crime, but it is a crime. If you aid or abet, and abet means to encourage, a criminal offense, then it's like you committed the offense. And lawyers call that being a party to the offense. So it's a criminal offense to possess any psychedelics listed in the Controlled Drugs and Substances Act. That doesn't include all psychedelics, but includes the major ones. Or I'll call that the CDSA. That's like the Drug Act. And so you can't possess it. So if you aid a person in possessing a psychedelic by, for example, telling them how to do it more safely, then you're committing the criminal offense of illegally possessing the psychedelic. Similarly, if you aid a person in possessing a psychedelic by attending at an unregulated event to make it safer, then you're committing the criminal offense of possession, simple possession under the CDSA. Or as well, if you tell someone where to get a safe psychedelic, then you're definitely committing a criminal offense. And hearing about how this came out with no consultation, my gut feeling is that this is the reason why, that either a lawyer or maybe Health Canada, who like to cause mischief, told them, you have to do this. That in a way, that's fine. Like, I can't get up here, even though it's terrible regulation, it's terrible guidelines, but I get it. It is very common if you polled colleges of every type of professional there is in Canada, in every province, they all insist on full compliance with the law. So you're not Like, we can't really complain that they want compliance with the law. Um, but what the college doesn't get is there is a way around this. And what the college does not understand is that these activities could be legal with a Section 56 exemption. And this exemption would not be for the clients, but it would be for the social workers. The social workers could be legal. And then if the college is taking the position solely to ensure social worker compliance with the law, social workers can say, I am completely legal in what I'm doing. Yes, I'm involved with some other people who are committing a very modest criminal offense, but they are committing a criminal offense, but I am legal. If they want their people to be legal, there's a way to allow that. And that exemption, that's under Section 56 of the Controlled Drugs and Substances Act. And I think if they knew that, that would change their position. Um, I'm not sure if I should just jump in and give a little bit of an overview on Section 56. Um, so this is really the answer. And I think, I don't want to be presumptuous, but I think if they knew this, it would change everything. So Section 56 allows the minister to exempt a person or a class of persons from any part of the Drug Act, some or all of it. And you might have heard, I bet a lot of people have heard of the big Section 56 exemption in BC, in which small amounts of certain drugs were no longer criminalized. But the section can be used in all sorts of ways. And like any researchers who listen to this are going to be familiar with it, and they're allowed to do certain things. The Supreme Court of Canada has spoken about drug offenses and the great variety of drug offenses there are out there. It's not like every assault is bad, every fraud is bad. Like, we don't really need a lot of exceptions for a lot of offenses, but drug offenses are different than other offenses, and our courts have recognized that there's a lot of different ways. This is not 1972. There's a lot of ways that drugs can be used in a positive way. And Section 56 is this critical tool that allows our laws not to look stupid. This is really a tool that should be used a lot, is what the Supreme Court of Canada has said to us. And in this case, what a social worker would do, and it could be for all social workers in BC, it could be a big group exemption, which they're all exempted. They would seek to be exempted from the offense of simple possession in situations where they're not consuming the drug and they're not providing the drug, and they're present in a professional capacity. So it wouldn't be a carte blanche. It wouldn't be like, oh, I can do this drug whenever I want because I got this 56. It would really be in very specific situations with various limits on what they can do. But like, that is knowing a lot about Section 56, that's a very gettable exemption. And now, I just, one last thing I'll say about this, that in my opinion, you could get a Section 56 exemption permitting you to advise of safer ways to do psychedelics and permitting you to attend at unregulated events. But in my opinion, you're not going to get a 56 exemption allowing you to tell people where to get the drugs. That's going to be a bridge too far. They won't give you that. And you probably will not get one that allows you to recommend unregulated drug use. If I had to, that's my feeling. So there is a line there, and there's kind of a spectrum of stuff they've ruled out, but there's a few no-brainer things that they've taken out, and telling people how to do things safer. Like, that's crazy. That's like some kind of rule. Anyway, that's crazy, as well as not letting them go to events. So sorry about my long ramble, but that's my take on these. That's my take on a few things.
I want to circle back to something that you said. It's brought up a curiosity in me, saying a whole group of people could get an exemption. So hypothetically, then a lot of our colleagues here and watching are in multidisciplinary clinics, are working with many other. Could therefore then a clinic apply for a Section 56 exemption for all their healthcare workers to provide harm reduction services and then be within the law if granted that Section 56?
Yes, yeah, no, absolutely. A clinic could do it for all their people. And there'd have to be a whole bunch of rules. You'd say, listen, these are the rules we follow. Like, we'll only do it in these situations, and when we do it, we'll follow these rules, and these are the safety precautions. You'd set out all these really responsible things that, like, you'd be a fool not to like. But yeah, absolutely, that can be done.
Okay, well, that's been tried too, and Health Canada ignored it for 3 years for us. So you could still put it in, but it could still be completely ignored.
I'd like to see it and how it was framed, so I won't comment. And Health Canada is terrible about responding, but I think this is a very gettable exemption. Did you get a refusal or no response?
No response, and then a refusal, a one-line refusal.
All right. Well, I can't comment.
We'll talk later. We'll find a solution for everyone, and we'll bring it back to the community and figure out how we can do this. So clearly you're saying that the college could have framed its guidelines to incorporate the Section 56 option if they had so chosen.
Yes, they could have framed it in a different way. Like how they frame it is really critical. This option doesn't become an option. So the new guidelines prohibit BC social workers from suggesting or implying safer ways to use illegal substances. If the guidelines were focused on the social worker's legal status, then that would be fixable with a 56 exemption, but the focus is on the consumer's status. And similarly with attending an unregulated event, if they don't do anything illegal, then 56 allows that. It's almost like a technical thing. It's like I see this as a lawyer. You're technically breaching the law of the land. We can't have that. And then you can come back to them and say, well, what if I wasn't breaching the law? But they framed it as the event or the consumers are, if they're illegal, then you can't take part. And if they'd framed it as the social worker can't be illegal, then that's fixable. The way they framed it can't be fixed.
Okay, so one last question to you before we bring Keith in. Are the guidelines constitutional?
So this is kind of a long, complicated answer, which I will try and keep short. So I believe they're unconstitutional, but it's not simple at all. So I will note that the people having their charter rights infringed are not the social workers, but it's the people who are attending at events who are being put at greater risk. I think the breaches could fall under Section 7 and Section 2B of the Charter. Section 7, it's a mouthful. It provides us with life, liberty, and security of the person. So that's kind of like the first part of it. There's like certain basic things that we can't have, threshold breaches, and then it must be done in accordance with the principles of fundamental justice. Sorry about that mouthful. It's essentially, for example, you could go to jail if you stab someone, and we all agree that's fair and you have your liberty taken away. But it's done in a manner, you get a fair trial and you get an independent jurist and a whole bunch of other rights. So you can have your rights taken away, but it's got to be for a good reason and in a fair and manner and a whole bunch of other stuff, which I won't get into. In Morgentaler, the Supreme Court of Canada said that where a law creates a risk to health by preventing access to health care, a deprivation of the right to security of the person is made out. And there's been lots of cases in which health care is interfered with or undermined, and that's a breach of security of the person. The key principle for I said there was two parts, the threshold breach and then the principle of fundamental justice. So the key principle for us is arbitrariness. You can't undermine someone's health in an arbitrary manner. The guidelines are making clients less safe for reasons that are arbitrary. They prohibit you from telling clients how to do things safely and attending at events to make them safe. There's no apparent reason other than your non-compliance why they're doing this. Like you're just making things less safe. One comparison would be it's like having a rule prohibiting seatbelts if the driver is speeding. And then seatbelts, of course, make things safer for everybody. Even people who break the law who don't follow the rules of the road should have the benefit of seatbelts. If there was a rule saying they didn't get seatbelts. And, a great comparison is the case PHS, which is the supervised injection site from 2011, Supreme Court of Canada, or in that case, a clinic had a Section 56 exemption, exempting the clinic from the laws of simple possession. And the Harper government refused to renew it. The clinic challenged the refusal, saying the refusal made things less safe for these people. The clinic was technically not complying with the law, so they needed the exemption. They were not complying with simple possession, just like social workers, in a very technical sense. They weren't providing it. They weren't saying where you can get it. They're just saying, look, if you're doing it anyway, we're going to do it in a safer way. Even though the drug users were breaking the law, And the drug users were breaking the law, just like here. So this isn't just for people who comply with the speed limit. Everybody agreed the clinics were saving lives and made people safer, including the Supreme Court of Canada, who said that the exemption should have been reinstated. It's very notable that in that case, they didn't strike down the law itself, saying Section 56 is this safety valve that fixes silly laws, silly drug laws that don't make sense. They said, don't worry, because we have this safety valve that fixes things. It was a classic harm reduction case, just like this one. Now, there is a difference between the two situations, and it's a technical difference. I'll keep it short. PHS was concerned with the Section 7, I'll put it this way. Section 7 cases they like to be connected to the administration of justice. So it's their rights, they're not freedoms. So some parts of the charter are freedoms. These are rights that you have in the context of the justice system. So this is less obviously, they were subjected to a criminal offense. This is less, their policy is less obviously connected to the administration of justice. So I just want to think this through. I don't want to just get on and say, yes, it's all unconstitutional. It would be a complicated challenge attacking a college policy for making things less safe. It's there, but it's complicated, and I want to give it further thought. The other thing I'll say about the Constitution just quickly is that I think the other relevant section, and this is a freedom, is Section 2B, which is freedom of thought. This is not a well-established area of the law. I'm trying to establish that psychedelics are freedom of thought tools. In Canada, charter tools are protected, like freedom of mobility is a passport's a freedom of mobility tool. A church is a freedom of religion tool. And our charter, our jurisprudence says those things are protected. So I'm trying to establish that thought, that psychedelics are a freedom of thought tool. And it brings about important thought like spirituality, connectedness, empathy. And this case is going to, I hope to take it to the Ontario Court of Appeal. So I have a case on this issue. My case is about psilocybin. It's the same argument for all psychedelics. If one has this right, then the guidelines are clearly unconstitutional. Section 7 is complicated. If this is true, then it's not complicated. People have this right and it's unconstitutional. The legal argument is not yet law, but I think the argument should be raised in dealings with them. And I'll just say this as well, but in making these arguments with the college, first of all, these charter arguments should be raised, but also when I talk about freedom of thought, don't get caught in this trap where it's either medicine for people with treatment-resistant depression, or else it's a party drug without any merit. That there's tons of peer-reviewed science that shows that it does all sorts of wonderful things: spirituality, connectedness, mindfulness, empathy, compassion, a whole bunch of other things, which I bet you everybody listening to this is familiar with. And this isn't just our theories, our experiences. This is peer-reviewed science. So there's important experiences going on. And this idea of freedom of thought, it's an evolving area of law, but I think as part of this argument, this is important experiences that you're helping people with, and they should be made aware of that. And I'll just finish off by saying, man, the people on this crew, Anne-Marie's pushback, it's amazing that you guys are pushing back on this, and this issue is going to play out across the country for healthcare professionals, all sorts of different healthcare professionals, all sorts of different provinces. And so this pushback echoes of this will be felt all across the country. So good work. I'll stop.
Thank you, Paul. I love the passion. And I put in the chat there for everyone, that's the GoFundMe to raise the money for the Freedom of Thought case. So if you guys can all throw a few dollars in there, we're going to get Paul to the Ontario Supreme Court, or whatever level we need to get freedom of thought. And that will be probably the fastest way that most healthcare professionals will be able to work legally with psilocybin in Canada. Go ahead, Karina, and then we'll hand it over to you, Keith.
I just wanted to add, Pam, and thank you so much, Paul, for that. So helpful to have your perspective on this. I think on the topic of freedom of thought, we wish we could have had an Indigenous elder here with us, but we know that Indigenous people have been using psychedelic medicines, what we call psychedelic medicines, for them, they are sacred medicines for a long time, for healing, for growth, for all sorts of things that we don't even know of. And yeah, and it feels also like not just an attack on social workers, but also on the wisdom of our ancestors. So yeah, I think there is much to be said about that. And I'm so happy that you're taking that challenge to court, Paul. So thank you for that.
I just really quickly want to give the credit to Laura and Kiffer from the Heal Lab. Thank you, Paul. But I've spread the letter like wildfire, but they're the original authors, and some people contributed edits, but I really want them to take the credit today. Thank you.
Keith, can we invite you in to tell your story, and then we'll move on to a robust conversation about the impacts and what to do and how to be change makers. Go ahead, Keith.
Yes, thanks, Pam. Just want to say I'm grateful to be here today, being able to share my lived experience with all of you. I'd like to thank all the people that have walked alongside my journey with me, and those that are here today and those who couldn't make it. Today's panel members, Laura and Dr. Kiffer, for putting the document together, and the Heal Lab Psychedelic Association of Canada and Therasol. Yeah, my name is Keith. I was born in Victoria, BC. I'm a father of 3 boys. Yeah, growing up in Victoria had its challenges. From an early age, I never felt safe. My nervous system was always kicking into fight or flight as far back as I can remember. Um, Grew up on a farm, and everyone was so busy that I had to use tactics to be seen and heard. Those are things that I would carry on through the rest of my life and use them as coping mechanisms that weren't always the greatest, but they served me at some point, and I could never get rid of those. I also struggled with ADHD, and as a young child going through that stage of wanting to be seen and heard and having ADHD, it made the impact of all of that a lot larger because the ADHD didn't want to be recognized. Um, yeah, a lot of fear growing up, anxiety, and I just kept storing that into my nervous system. Kept stuffing it down and hiding and running away. And eventually the tactics that I was using to protect myself and find that love and attention would get me labeled as just a screw up and other words that I won't share in here. Yeah, so I carried that title of just being a screw up through my teen life and then into my early adult life. It was at age 14 that I found alcohol. Drugs soon followed after that. And with that, it was like as soon as I started, it was the perfect escape because I no longer had to feel, right? I didn't have to face the reality of what was going on inside. Um, I was always the guy who was the last guy up or the first guy to pass out, blackout. Um, and where I passed out was where I passed out. Maybe I made it to a bed, maybe it was a ditch, maybe it was back of a car, back of a truck. It just progressed very rapidly. Um, until I found I'm in recovery, and I found what's called my drug of choice at age 21, which was cocaine, which later turned into crack cocaine. And that night that I first tried it, my life just shifted. Like I was no longer employable. I was no longer accountable, and the despair grew. I moved cities to escape addiction. I changed substances from one to the other, and I just could never escape the grips that it had on me. It would follow me everywhere. Uh, and the life I was living was not a life that was worth living. It would be 10 years of addiction to cocaine and crack cocaine, um, until in 2012, I ended up in ICU for 2 weeks at the hospital. I almost lost my hands and feet due to the impact of the disease of addiction. From there, I had a friend show up and introduce me to recovery. It was either I can continue living the life I was living, or I could go to treatment and try and rebuild this life, which I never really like, even saying that, trying to rebuild a life. I never really had a life, right? So a lot of people say I want to rebuild my life, but for me, I just never knew what to do. I never had a foundation of what I wanted. Um, yeah, so I went into treatment. I stayed there. I stayed clean for 3 years. Um, but just like, I was introduced to 12 steps, and just like the 13 years that followed the beginning of recovery in 2012, I, I just couldn't get it, right? Like I would get clean and I would build up this beautiful life, and then I'd tear it down because I just didn't feel worthy. There was something inside of me that told me I wasn't good enough, and I could never unpackage that, right? Like it was so hard. Every time I would try and go into traditional talk therapy and talk about stuff that had happened in my childhood or wherever, it was so much that I would end up going out and relapsing, and it was just this trend that would happen. So I would think I would be in a healthy place. I would try and dig into this, and traditional talk therapy just did not work for me, to unpackage all that. Uh yeah, this beautiful life, like so many times people have said, like, you're great at building, like you will fall down, but you get up and you build this beautiful life. And but it's been so many times, like it gets tiring. So in November of 2021, the day before my 40th birthday, I engaged with my first psychedelic assisted therapy. I did psilocybin. I think I did around 7 grams, and the blindfold and headphones, and went fully inward, and let the medicine do its thing. And I remember waking up the next morning, and I just had this feeling that everything was going to be okay. And the 6 months to follow that, I'd be riding on this pink cloud, like just this magical, nothing could affect me, nothing could get me down. But then life comes around, right? So what do? My coping mechanism is to use drugs. So I went back to that. And for me, I'm not an everyday drug user. I'm a binge user. Like I would disappear, and you can only paint that picture of being in a relationship with kids and everything, where all of a sudden I disappear for days on end and can't be found, can't be seen, not answering the phone, just completely missing. And the amount of people that have been affected outside of this disease of addiction because of my choices has been a lot to handle. Um, so after struggling, the struggles continued. So because I didn't, after I did the first psychedelic assisted therapy, I walked away from, like, I'm part of 12 steps. And I walked away from that because I had so much shame, because I wasn't able to openly talk about it. I didn't have a support network that I could really share what was going on, and I felt like a failure and that I hadn't done it right. And so in leaving that, I didn't have the foundation of recovery. Like, it started to dwindle away. So to me, it's a two-part thing. So I went back to 12 steps, and then that didn't work. So I said to myself, if you relapse one more time, after all the research I've done on MDMA therapy, assisted therapy, I decided that one more time, and I'm engaging in that. So, what was that? That was 2024. I engaged with Therasil, after a relapse, and it was basically at the point, like, this isn't working. I need to try something different, right? And like the way, like there was nothing that would work. There was always this despair. There was always this self-hatred. Um, and the day I did engage with Theracell, I remember it didn't fix anything, and neither did the medicine. But that day, I just remember the hope it gave me. And at that time, when I was sitting in this bottomless pit of hatred and like despair, and like just not wanting to be here, um, that it was a gift to have that bit of hope. So in November, I was put in touch with a psychologist through Theracell. We ended up getting me a diagnosis for PTSD. We submitted our application through the SAP program, through Health Canada, and did everything properly as we were supposed to. And then it just it went radio silence from Health Canada. And due to the wait times and the impact that it was having on my life, I could feel it starting to shift again. I could feel that like, okay, everything's good. What's gonna happen next? So I didn't have another relapse nor another coming back from a relapse in me at this point in my life. It was probably gonna be it. So I decided that to go underground at that point. Um, it was at that time a registered social worker was brought in for the preparatory sessions, for the medicine journey, and the integration sessions. Um, there was a lot of struggles within that first medicine session. Um, the thing that I pulled the most out of it was the experience that was followed by the ability to create an environment by the registered social worker for me to process that what had happened safely. The training and the ethics that showed up in that setting for me was exactly what I needed. And that was if social workers aren't allowed to practice with this, like people, it could be really damaging. I feel that's my belief on this, that this medicine needs to be guided. Um, yeah, so after that, October 18th of last year, I did another session with a RSW and a medical professional as part of a new therapy team. Um, there was a lot of hard work in that room that day. So many things surfaced around my life, and I actually felt worse the following weeks than I did going into it. Like it brought up so many things. The medicine made me feel like a failure, and there was a lot of things that had surfaced where I just had this doubt of myself again. But again, the social worker was able to not even like guide in that sense, but like ask the right questions to be able, yeah, I guess that's guiding maybe. I don't know, like be able to ask the questions for me to come to a conclusion of what was really going on and to safely unpackage what had happened in that through the integration sessions. Um, and that was very beneficial to have someone so educated be able to walk me through the integration. The integration is where all the magic happened. Right? Like it was the medicine journey wasn't the most fun. The first one was loving and caring, and I just sat there holding myself, whereas the second one was pretty dark. And if someone experiences that without the right support, it could be very damaging. So the result from all of this, well, I'm no longer defined by my past experiences. I no longer live in shame. They're a part of me, but the biggest part that I got to in all of this was being able to look at my past and to be grateful that everything had got me to this point, right? Like I'm not happy about a lot of the stuff that's happened. I wouldn't sign up to do it again, but definitely I wouldn't be here. I don't know where I'd be if it wasn't for everything that happened. I wouldn't be going on this journey. I wouldn't be doing all of the stuff that I'm doing, and living this life that I'm living. Mm. the impact the medicine had on me was like a baseline. Like my days aren't always amazing, but I can handle them now. And I'm not in fight or flight. Like I can sit calmly. My friends used to always get like stressed out sitting beside me because I'd be jittery and moving, and it was just my nervous system trying to get out of every situation. And the medicine was able to help with that. Currently, I am self-employed. I've been in the trades for 26 years, but after the effect and the drastic change that the medicine put into my life and the work that I did with it, I've decided to enroll in school to actually become a social worker myself, so that hopefully one day I can work with the medicine. Um, so I started in January, and then like a week into it or whatever it was, I heard about the regulations and I'm like, oh. But yeah, that's the impact that it had on me is I want to work with this. I want to share this with people. I want others to be able to experience this opening that I had in my life. Uh, Sorry, forgot where I was in my notes. Um, 11 months after I applied for this, oh,
Yeah.
so sorry, I'm just gonna skip ahead here. Um, it's a beautiful life, and Health Canada keeps turning people down. And like, if I didn't go underground, the reality is I wouldn't be sitting here telling this story today. I wouldn't be an example of the medicine working, and I don't know if I'd be breathing today. The strict rules, the timely manner, the new guidelines with social workers, all of this, for me, it was able to help me in the disease of addiction. I know there's so many other areas that this medicine can help people in. But like stats are 20 people a day are dying in Canada of addiction. And we're still not granting people the opportunity to get well. Regulations around social workers working with psychedelic-assisted therapy need to change, as well as the special access program needs to grant more people access to this medicine, especially those suffering from life-threatening illnesses like addiction. Um, the substances weren't the problem with my addiction. They were a way out from feeling the pain and suffering I felt inside. But after working with the medicine and healing, I can proudly say I no longer look for a way to numb. Like, I don't sit and try and escape. I can sit through my feelings. I love myself today. I'm honest. I show up with authenticity for my family and friends. I attend my kids' sports. I'm active in their life. Even this year, I got to go to Game 7 of the World Series baseball with Toronto and the Dodgers with my oldest kid, and experience that where I wouldn't have that experience if I was still using. Um, Not only is the relationship strong with my kids, but with the co-parenting relationships that I have built because of the skills that I've developed through all of this. It creates and it's the ripple effect where it flows down into my kids see this environment where me and their mothers co-parent, and they feel love there, so they can put that out into the world, and it's really a beautiful thing to watch that ripple. Today I have integrity, my words and actions are aligned, and none of this would be possible without the help I received doing the medicine work with a social worker. So with all that, thank you for taking the time to hear my story. If you take anything from it, please let it be that without the guidance I received personally going through psychedelic assisted therapy and integration, this story wouldn't be the same. It wasn't the medicine that healed me, it was always there inside me. The medicine helped bring it to the surface, and an RSW helped me decode it and apply it to my everyday life. So thank you.
Thank you, Keith. What an honor to share that story with all of us. I think we all feel pretty privileged that you shared that with us. And I really hope that there is somebody on this call from Health Canada, because they need to hear these stories. They really do. So one thing I have learned from all the politicians we have spoken to via the Psychedelic Association of Canada is they need to hear these stories. Your members of parliament, your MLAs, the health ministers of your provinces, the federal health minister needs to hear these stories. And if they do hear enough of these stories, that will start moving the bar. And it seems to me, and I've done more than my fair share of SAP applications, and you're right, Keith, it's slowing down. It's getting much harder. It's disproportionately harder. We got some of the very first SAPs in Canada at Roots to Thrive, and it takes me 4 to 5 times longer to get a yes now than it was the first time. And Health Canada needs to hear these sort of stories. And what is also very clear is, like, clearly you had a wonderful, loving, caring mental health professional with you on this journey. And these guideline changes really disadvantage, because there's so many of us that are healthcare providers, like from the doctors and nurses, nurse practitioners, naturopaths, like social workers. I mean, I don't want to miss any, even occupational therapists, physiotherapists. Like, we are all always dealing with mental health, and it is expected that we will deal with mental health, and these just seem to handcuff a whole group of our colleagues for no reason. It's not in alignment with any of the other colleges and where we're moving forward to safe practice. So let's open it up to everyone. Mary, Mary, you want to jump in because you bring the US perspective as well. And then let's talk about what this means and what are we going to do about it? Because you guys are leaders and we are change makers. So we're not going to just sit and let this sit. We're going to change this. But over to you, Mary.
Thank you, Pam. And there's so many things I want to say to you, but Keith, first of all, thank you so much for sharing that with us. But I love, you are such a perfect one to be able to share your story with those people we're saying need to hear that, because what you brought in, which everyone doesn't when they have these experiences, is what the bottom line, the core is it's not the medicine. I mean, it is the medicine, but it's the integration after, and how it's not always easy, even if you have a meaningful experience, and that you realize that, and you can bring that forward, and that you had, like Pam said, like you say, that you had that skilled, social worker and I love how what you said, it was guiding, but it wasn't guiding, asking the right questions. So this is why we want to have, a skilled clinician who knows how to work with these substances. That's so different. And I also was thinking, as you were talking, especially towards the end, being at Hopkins for over 2 decades, once we published our first study in 2006, we started in 2000, we just continued, and of course we ran more studies, so we just continued to get more and more calls of people who were like, I need help. My son needs help. My mother's dying. My son has severe depression, and I'm not qualifying for these studies. And having to say there's nothing to offer you, when I know I've seen over the years it can be helpful, is one of the very hardest things. So anyway, I wanted to thank you, for that, and hope you're able to tell your story as you do, to those that might hear it, that can make a difference. So thank you. Yeah. So I'm going to switch gears now, just to let you know. I'm just going to spend a minute on the NASW, the National Association of Social Workers guidelines, because there aren't any. There's currently no specific guidelines for psychedelics at all. Whether it's illegal or in legal settings. And what they say is that we have to follow the existing NASW Code of Ethics and the standards for substance use disorders. So if you look at those, ethically, yeah, you have to tell people what the risks are, and all of that. So if you're following that as a social worker, then you tell them. It doesn't say if you're doing it illegally, so it doesn't address that. But what I can say at Hopkins is when we started in 2000, we really were the pioneers. Roland Griffiths was the one who got it as the pioneer to start this after so many decades of being dormant. There were a couple of studies earlier, but this was really, the first to really get it going off the ground. And so we really didn't have any guidelines. And it was just Roland Griffiths, Bill Richards, and myself. And Bill Richards, we had him who did this work back in the 60s and 70s. So we had someone who, knew a lot. But even back then, they didn't have many guidelines. So we just had to, as we continued with our studies, we realized we need more and more, we need to have, guidelines. So in 2008, we came out with, published a paper on safety guidelines. And it talked about all the different things that, you need to be aware of. So that's that. But what was one point I want to make, which was so bothersome to me when I heard, Laura shared that with me, the guidelines, is that you cannot tell what the risks are or do any harm reduction if you're going to use it illegally. And that is something because I'd get so many phone calls saying I can't do it, but can you help me? And so we really had to sit down and say, what are we going to say? Because it is illegal. And so, we thought about it, we looked at it. Ethically, we said, we have to tell you. We preface with, these are not legal, so we're not condoning it. And we will not give, any underground people or that type of information, but we'll give you all the information we can about doing it safely. And once our paper came out, we give them our paper if they want it. So I'm going to stop there because I've talked a bit, see if anyone has any questions. So we always talked about that as important ethically to tell people. So thank you.
Thanks, Mary. I think I'll just follow up a little bit and expand on that it's like this idea that what's legal is not always ethical, and we see it, in many places. And that's really the struggle here, is that it's putting us in a place where we can't really do what we know is ethical. And we now have to second guess, what is okay to say, what is not okay to say. And even just showing up in the therapy space with our clients, it's already going to affect our clients' ability to open up and trust whatever we want to share with them, because we're not even sure as to what we can or cannot say anymore. And so yeah, lots of concerns around how ethical this guidance is. And also, I actually remember reading a document created by John Hopkins, I think, Ethics Working Group. I don't know if you were involved in that, Mary. And one of the things that kind of stood out for me was that, like, the truth is that the vast majority of people are going to be using these substances. Like, it's not going to happen in a clinical setting, right? And so how can we support our regulated professionals and the healthcare workers to really be knowledgeable and be prepared to have conversations with people and understand what they are going through and what they're seeking, right? And so I think that's there's a big gap there that I hope we can really address at some point.
It seems to me, though, that you guys are leaders. You've taken the reins here. Our colleagues here in Canada, you've stuck your neck out. You've got the letter going. You've got a huge positive response. why don't you just rewrite the guidelines, rewrite them, and then present them to the college and say, this is a more evidence-informed and more aligned with other healthcare practitioners, and say, you've just made an error. Why don't we just fix it and do that?
Thank you. Yes, the letter has been getting great response, and I'm actually gonna put it in the chat so that everyone that hasn't had a chance to like look at it can look at it, sign it, share it. We would love to do that. We just don't have a conversation, and that's maybe something that we can have a conversation to and clarification maybe from Paul too, because there is no response from the college. There is no collaboration. We could do this, and in fact, Kiefer and myself and the community practice, we have been working in some guidelines. And the guidelines are from practitioners by practitioners, and it has been something that we've been working for the last 12 months. So we also have something in place already, but the college is non-responsive. We haven't had, many of us have reached out. We haven't heard back. And I don't know what the responsibility is to respond to their members' emails. I don't know what the extent of that looks like. So we're definitely open for collaboration. We're definitely open to bring in some, we already are started the work. We have some wonderful guidelines that are simple, therefore, against practitioners by practitioners, and we would love to bring in the social work spin to it. But we don't have that open communication with the college yet. So yeah, that's kind of where we're at. So I'll put that in the chat now. And I just want to take a moment and say, Keith, thank you for your story. My heart is like so full, and I'm so grateful that you've joined the social work profession. It's such a gift. And thank you. I'll just put that in the chat now to you. And if you have any questions specifically about SFU, the letter, next steps, you can always email me. I will put the email in the chat too. And there's a mailing list option. So if you want to stay up to date with anything that SFU is doing in the Heal Lab, you can also pop your name there, and you can stay updated with all of our efforts. Thank you.
I'll jump in real quick just to share with you. It came out in 2023 at Hopkins. So they did a survey study on naturalistic settings versus clinical trials, with the guided sessions and the way that we run them now. And so in the naturalistic setting, the majority, as you know, did it festivals at home, nature, privately. They were usually self-directed or with peers, friends, untrained. There was no formal screening. High-risk populations participated, and significant average improvements. Oh, well, yeah. So that was the difference. So interestingly, two outcomes to share. One is that in both of them, there was significant improvement in mental health issues. But what was very interesting, in addition, was the adverse events, and it was extremely low, managed if they occurred in the ones that they hadn't gotten the survey, if they were the clinical studies and guided. But in the naturalistic non-guided sessions, the high risk of challenging experiences was 7 to 11% reported persisting negative effects. And it went from, and this was almost 3,000 people. So 7 to 11% said they had significant persisting negative effects. And so that's just to say, we need to give guidance to people because, like you said, Karina, the majority who take these substances, that's how they're going to take them because they're not available. So I wanted to throw that in.
There's been, and I'm glad what SFU is doing, creating guidelines, and to make, there's lots of stuff out there that's been out there for many decades too. Guild of Guides has had guidelines for a long time. We've had at the Psychedelic Association of Canada on the drop-down menu under ethics. We have codes of ethics. We have guidelines on how to be a good therapist, how to find a good therapist. So in that space of harm reduction, these documents are there until these things go forward. And Additionally, Vancouver Island University's postgraduate certificate has a very comprehensive guideline of what a psychedelic therapist should aim for in their competency training of about 21 years, which we're pretty clear of that a really solid psychedelic training program would be about 21 years. So keep that in mind as you keep gathering lifelong learning going forward. We have about 14 minutes, and I think it would be great to hear everybody's voice in this space. So final thoughts, what you think we should be doing, what you want to be doing, how you want to be involved, whatever, because I think you guys can change this. We're going to cheer you on here as an MD and go, we've got your back, but whatever we can do to help. Cody, would you start us off and then popcorn style around?
Sure, thank you. Yeah, I think I want to make a more general comment that, and I appreciate a lot of what Paul's doing. That I think one thing here is our focus on the guidelines, and there's a bigger conversation here about drug policy reform. And I think that this fits within that. Psychedelic medicines have their slice of that pie and have some important aspects to what they're able to do sort of therapeutically, as well as in, different pro-social ways or, for the betterment of well people, as Bob Jesse put it. And, as Mary has said, people are using psychedelics in a lot of different settings and for a lot of different reasons. And I think it's important for social workers to be able to play a role in contributing sort of knowledge and expertise in harm reduction across those settings. And as we, narrow in specifically on psychedelic-assisted therapy and, what we're more focused on here, I'm grateful that we do have this special access program in Canada and that there is a pathway that, wasn't available several years ago for us to get access. And, from Keith's story, from what Pam said, from my experience being involved in these applications as well, Health Canada has been slower and slower to make those approvals. There was a study published in Nature Medicine last year where they showed a statistically significant decline in SAP approvals in psilocybin, dropping from 82% in 2022 to 59% in 2024. And I would guess it's even declining more. And, and this is a challenging program to access. People need to have treatment-resistant conditions where there is a substantial research body of evidence to show that there's benefit for that condition. They need to be able to find a physician and clinicians that are going to be able to do this, that are willing to put the time into that application. They need to have the patience to wait. And then they also have to have a team that really knows how to frame that application, to send a legal letter to follow up when Health Canada doesn't reply, to, form good arguments in appeals when they're refused. It's very challenging. And the people that are in the position to get those approvals are often in the worst position to pay for that and to be that patient. And so this is, it's really challenging. It's accessible for a small number of people, and that leaves frustrated individuals like Keith, or even worse, people that call our clinic and we're like, sorry, you're not eligible, kind of like Mary said, like, I don't know, what we can do for you, to then go out and try to figure it out themselves. And again, now there's a role for social workers providing harm reduction information and education, especially those of us that are, trained in this area. And I think it is our ethical responsibility to be doing that. I'm keen to participate in whatever initiatives might come out of this to try to, engage the college in revising these with more input from, research, from knowledgeable practitioners, from those of us with training and experience. And, I think it's our duty and our responsibility to make this sort of more accessible to folks, which is, really what's important. And because there is interest and demand, we have a lot of people, approaching for these things. And just one more thing, like Mary and Keith emphasized the importance of integration. And I agree with that in terms of sort of the durability of the results and changes, especially therapeutically when we're working. And I actually think all the stages, the preparation process, the medicine session being held well, the integration being done well, are all, what make this most safe and effective and productive. And, when we're put in a position where we can only provide some aspects of preparation, some aspects of integration, and we're unclear on the information that we can provide because we don't want to be seen as encouraging anyone to use an illicit substance, our hands are tied, or my hands feel tied in terms of, what I'm able to do. And at worst, one of the things that I don't like doing, that I'm often put in a position of doing in my private therapy practice, is seeing clients who come for integration support that have had bad experiences. They've been in another container, they've done something on their own or with peers, they're struggling afterwards in the integration, and now they're coming to someone with knowledge and expertise around integration. But it's like, wow, if we could have done better, in preparation and supporting that person through the experience with better harm reduction information. Also, wow, if we could have actually been there to support them too, this could have looked a whole lot different. And now we're, cleaning up messes in some cases rather than, supporting people in a better way. So yeah, thanks for the opportunity to share a few thoughts there.
Karina, then tag somebody.
Sure. I agree with everything you've said, Cody. I think, I don't know, there's this piece around, the harm reduction movement versus the medicalized harm reduction approach that we kind of like see more commonly. And to me, like, the reality is that harm reduction exists as a movement for the people and by the people when the war on drugs has failed people and when the medical system has failed people. And so this has been a reality. It has existed for a long time, right? And so it feels like, it's not something that we don't need to reinvent the wheel, so to speak. Like, I think we just want the authorities to really embrace it and move forward, because we've done the opposite already for too long, right? And what I really hope for the college is just more openness. If they haven't figured it out, like, maybe just acknowledge that, as opposed to taking kind of like a very close-minded approach of like, these are the rules and that's it. We've reached out to the college by email. So many people have tried to connect with the college, and the college is just not talking to us whatsoever. And yeah, it's just heartbreaking, not just for us wanting to do this work, but for all the people that are hoping to have access, right? And yeah, I don't have a solution, but I do like all the ideas that have been shared here, and I hope that we can keep the conversations and coming up with ideas to make this work more accessible. So yeah, I'll tag Anne-Marie.
Thanks. Yeah, thank you all of you for sharing, and especially you, Keith, for sharing your story today. So much gratitude for you. I second everything that's been said today. I guess what stands out for me is that as upsetting as this guidance was, I'm kind of grateful for the community, how it's brought us together. We're having these conversations, we're supporting each other, and the open letter has been a great success. I'm really excited for that to get sent to the college, and remain hopeful that once they receive that they might be open to revising these guidelines with some expert consultation, which absolutely needs to involve people with lived and living experience. And yeah, if not, if things don't change, I think myself and many others who are dual registered might just choose to drop the RSW designation and practice as an RCC, because there is just no part of me that will accept that I can't talk to people about safer ways to use substances. That just goes against everything in my soul as a human and as a professional. And yeah, it's just not ethical. So I'm remaining hopeful, but I'm also appropriately angry So I will tag Laura.
Thank you, Anna Marie. And I really appreciate you naming the community and kind of how this has brought us together because I think we're in alignment in how we're feeling and how we're approaching this. I think we all came in from different experiences and wanted to do this work and engage in this work. Um, I did some work at a ketamine clinic, and although the work was wonderful, was very inaccessible for people at times. And we've just created more barriers and more barriers for people to access this type of work. Mm, and yeah, there's a moment of like values and alignment for me as well. So our next steps are going to bring this forward to the college, open more conversations, engage in conversations with them, and hopefully we can create some movement. But I think right now we're holding both, right? We're holding hopefulness and also trying to figure out how we move forward with this. Um, Thank you, Pam, for putting this together and aligning all of this for us and having these conversations. And I'm so grateful for everyone out there that's doing this work, that's showing up, like that's holding space for clients, families, communities, and this work is really hard. And so it requires for us to feel safe. And it feels like the college is saying, you can do this by not doing it. You can ride the roller coaster without getting on the roller coaster, pretty much, or whatever it is kind of how is abstinence almost feels like an approach. So really we need to feel safe in doing this work because it requires a lot of us and a lot of our clients. So thank you everyone for your time. And I will tag Paul because I do want to hear about is the college responsible to respond? Like, do they have to answer our emails? And that's something that I really want to kind of figure out today.
Can I jump in just for 30 seconds before you, Paul?
Oh, yeah.
Because I have to run. I don't really have anything else to say. I said it all. So I just want to thank you all. I appreciate getting to know you all, hearing where you're going forward. Good luck. Thank
Mary,
you.
thank you so much for coming. You're an institution, so
Yep.
thank you for all your work.
Yep.
It's Paul.
Thanks, Laura. I believe they do. I'd like to get you some authority. Ultimately, colleges are responsible to the public to keep the public safe, which they're obviously failing in that. But you have a very specific question, and I'm going to get you some authority on point about that. So I'll get back to you in the coming days. Feel free to remind me. I'm swamped, but that important question. And in terms of my final comments, I'm just, again, will repeat my admiration for Laura and Anne Marie and the others who are like this drug war. I'm a lot older than I look, and I've seen so many different aspects of the drug war. History will remember you. You will win and you will succeed, but it's going to be a tough fight. And so don't give up. And if I can, in a small way, help you fight better, I'm happy to do that. So don't stop. 2.3 million Canadians use psychedelics. That's the most recent stats. And how many of those were SAPs? This is a travesty. It's like shockingly, stunningly stupid. So anyway, good on everybody. And I am to tag somebody, and I'll tag Cody, who I spoke to the other day and had such clever remarks about this clever take on the issue. So I'm happy to tag Cody.
I think I already had my final remarks, so it might be Keith is left.
We close strong. Yes, Kid.
Thanks, Laura. Hi guys. Thank you everyone that shared on this panel. The knowledge that's been brought into this has just been it's been an honor to sit here with all of you. Uh these regulations, like some things have to shift, and the amount of work that's been put into this has been I've been watching it kind of from the beginning when the letter first got put out, and just watching the names on the letter grow, and then this is happening and all these things coming up. It's like Emery said, that it's like a community bonding together, and I'm grateful to be able to be a part of it and share something that will hopefully spark some interest to someone hearing that this isn't going away. And without the use of this safely, like I shared in my story, like it's detrimental to people's health, and mental health needs to be taken serious. There's so many uses for this medicine. So let's, yeah, keep going. Thank you, everyone.
I want to thank you all. This has been brilliant. A couple things. Remember, all good things come from the grassroots up. Okay, so take the control, make the change, and go forward. And all this other professions will be right there with you to support you. But don't. You just have to know this. All the changes come from the bottom up. So do it. I'm also gonna highlight again Paul's case coming up. Again, this is a grassroots effort. We would love 10,000 people to contribute to this. That way, 10,000 people will own history in the making when Paul wins that case for freedom of thought with psilocybin. So you guys are the leaders. You're the change makers. Everybody that showed up today to watch this, go out there and make the change. Let's do it. Okay. Thank you, everyone. Have a great rest of your Friday. Have a brilliant Saturday, Sunday. Go outside, get off the screens, and nourish yourself. Until next time. Thanks, panelists. You guys are phenomenal people.